Hello, and welcome to the National Environmental Health Association's Grand Rounds Seminar, Beyond the Inspection, Cracking the Case When Foodborne Illness Outbreaks Strike. My name is Nicole Dutra, and I'm a Senior Project Coordinator here at NEHA, and I will be moderating today's seminar. As we give a moment for others to get logged in, if you have a cell phone handy, please take it out so you will be able to take part in a few survey questions throughout the seminar. All right. So with your cell phone, if you could go ahead and scan that QR code that you see on your screen. And we will also drop the web address in case you need that. We'll drop that into the chat for you. And you'll use that passcode there, NEHA24. And it should take you right to the Slido account. All right. And the first question should be coming up for you on the Slido. So first, we want to know, where are you joining us from? I see everywhere. Oklahoma, Georgia, West Virginia, Washington, Maryland, Delaware, San Diego, California, Kentucky, Lincoln, Nebraska, Indiana. I think I saw Hawaii in there somewhere too. Toronto, Cheyenne, Wyoming. Awesome. Thank you all for joining us today. All right, well, allow me to quickly review the agenda for today's seminar. To begin, I will review the learning objectives for today's seminar. I'll provide a few brief announcements, then I will introduce our guest expert speaker, and we'll spend a good portion of today listening to the presentation and going through some expert stories from the field, conducting investigations. With that, allow me to cover a few housekeeping items before we get started. Please note that the seminar is being recorded. The seminar recording will be uploaded onto the NEHA Environmental Public Health Grand Rounds webpage, and we will drop that link in the chat for all of you in just a moment. Again, please use the Q&A option that you see on the Zoom screen to submit any questions that you have for our speaker and panelists. You should see that Q&A option there on your screen. It could be along the bottom or the top. And at the conclusion of the seminar, you will receive a link to take part in an evaluation survey so that you could provide us your feedback and comments on today's seminar. So the National Environmental Health Association is the professional home for people working to protect the public's health and environment. We've been around since 1937, supporting thousands of members in government, industry, and academia. Our mission is to build healthy environments, protect communities, and empower professionals through education, credentials, and advocacy. We offer nationally recognized certifications like the REHS and RS and CPFS, ongoing training, mentoring, and a strong professional network. When you join NEHA, you're not just joining an association, you're joining a community that helps you grow, connect, and make a difference. Learn more about NEHA and how it supports environmental health and how you can be a part of it. If you're not yet a member, becoming one is very quick and easy. Just scan the QR code there on the screen, and you'll be taken right to the page. We'd love to have you as part of the NEHA community. A couple of upcoming webinars that we have on Wednesday, November 12th. Beginning at 2 p.m., NEHA will host the webinar Rodent Control Frontiers, Monitoring Technology and the Science Behind Smarter Solutions. And we'll drop that link in there in the chat for you in just a sec. And 2 days following that one, we are doing a webinar on the food code. It's going to be a preview of NEHA's newest course. And in early December, we will be hosting another Grand Rounds seminar on building a prepared, responsive, and resilient environmental public health program when disasters strike. So we'll drop all those links in there for you in just a sec. We're thrilled to also invite you to NEHA's annual educational conference and exhibition called Woven Strong, the Environmental Health Tapestry, August 3rd through the 6th in 2026 in Kansas City, Missouri. This year's theme embodies how every thread, our expertise, experiences, and innovations interlaces to create a stronger, more resilient future in public and environmental health. At AEC 2026, you will discover the latest cutting-edge research and best practices from across the field, gain fresh perspectives from diverse voices, and leave with practical ideas you could put into action. You'll connect with peers, mentors, and partners, and you could add your own thread to the conversation by learning, engaging, or supporting others. Every attendee helps reinforce the tapestry. Registration opens in December, so mark your calendars and check our website in December and plan to join us in Kansas City. All right, I have another Slido, so grab your phones. Question for all of you. Have you taken part in a foodborne illness outbreak investigation? Looking at 81, 76%. So a good number of you have. And I'm assuming those that have not may be new to the field and here to learn as much as you can, which is wonderful. We welcome you. Awesome, 73, okay. All right, another question on Slido for you. So effective outbreak detection and response relies on the collaboration of the three-legged stool: environmental health, epidemiology, and laboratory. Which of these relate to you? Good portion of environmental health. We have some EPIs. So, looks like we don't have anybody lab. Okay. All right, thank you so much. All right, so we will begin. Please welcome our expert speaker, Senior Environmental Health Specialist Clay Callaway from the Environmental Related Illness Program at Maricopa County Environmental Services in Arizona. Clay, the floor is yours. I will stop sharing and you could go ahead and share your screen.
Thank you, Nicole.
Of course.
All right. How are those visuals? How's the audio? Can everybody see? Can everybody hear?
Looks great.
Excellent. So yeah, my name is Clay Callaway, and I'm a senior environmental health specialist with Maricopa County Environmental Services. I'm out in Phoenix, Arizona, and I'm in a program specifically that handles illness investigations. And I've been participating in the National Environmental Assessment Reporting System since 2019. Today we're here talking about environmental assessments. And if you're investigating an outbreak of foodborne illness, you really want to be conducting an environmental assessment. And you want to do that because this type of process makes it possible to find the cause of an outbreak. So first, starting off, what is an environmental assessment? Some of you may have never heard that term before, so it's important for us to kind of specify what it is and what it isn't. And to do that, I've got a nice slide here that's going to help differentiate what it is and what it isn't. Put simply, environmental assessments are a type of field visit. And it's an appropriate field visit when you're investigating an outbreak involving a food establishment. Why is that? Um, an environmental assessment is going to examine how the food may have become contaminated, caused illness, and importantly, how to prevent it from happening again. I saw from the Slido there that a lot of us are with environmental health. So most of us are very familiar with the most common field visit, and that is going to be routine inspections. And when we're doing a routine inspection, we do these broad assessments of the establishment, looking for any weaknesses that might be currently observable. It's a snapshot in time. What is happening right now that's out of compliance? That's what we do a lot of the times, routine inspections. You might also be familiar with plan review inspections. And for a plan review inspection, you're going to look at the establishment not as so much as a snapshot in time, but you're going to consider what can happen here in this kitchen. Are they set up for future successes? Can they avoid conditions in the future that can lead to an illness? Now, the last box here, investigation or environmental assessment, it looks retrospectively to identify what went wrong. So instead of focusing on general compliance like we would do in a routine inspection, it's going to be more specific. The investigation is going to be driven by the agent and the food, or how did the agent get to the person who became ill? So kind of putting this slide all together, routine inspections, they look at the present. And plan review inspections, they're going to look at the future. But if we have an outbreak is going to be something that happened. So we're going to have to look into the past. Okay. Usually the process of an environmental assessment starts with the identification of an outbreak with people reporting illness. And this helps us identify a suspected causative agent and exposure. And what we need to do after that is to try to figure out how the outbreak happened, leading to that identification and selection of a contributing factor. So an environmental assessment helps to identify the underlying causes of foodborne illness outbreaks. And you see here, outbreak cause is the what, contributing factors are the how, and we'll get into the root cause of, okay, why did this happen in the first place? To figure out how an outbreak happened, the investigator can engage in a variety of different activities. And you can see some of those activities there. Interviewing managers and workers to understand the practices and policies. And kind of one that people don't think about very often is to determine if any workers have been sick. It's going to also involve observing food prep, observing how restaurants actually prepare the food. It is going to involve reviewing records such as food storage, cooking temperature logs, any type of records that they keep on site. And in certain circumstances, this is also going to involve conducting environmental sampling for pathogens that are in a restaurant. So these activities, when we take all of these together, that is going to be a big portion of an environmental assessment. And again, these are designed to describe the outbreak environment and to identify causes of the outbreak. Okay. The focus of an environmental assessment is to understand how and why the outbreak occurred. Um, Everybody has a job in an investigation. You see the disease triangle here on the left. And we also see the different professions that are working in those different areas of the triangle. So epidemiologists, really epidemiology as a whole, they're going to look into the host. The lab, they're going to look into the agent. And when it comes to environmental health, we're obviously going to look into the environment. When I explain this to people, I kind of explain investigations and outbreak response as a big group project. And if you've done group projects before, you might have some good experiences with that. You might have some not so good experiences. I bet that if you've had an experience that you didn't like in a group project, it's probably because a group member didn't do their job. So what's important to remember when we're working with all of these different disciplines is that you have to show up and you have to do your job. You have to do your component of that response. And as environmental health specialists, During an outbreak investigation, our job is to get the how and the why. That is what we're there to do. Um, and when we look into the environment, when we're actually going into that establishment and doing this assessment, our goal is to understand how a pathogen was allowed to either contaminate, proliferate, or survive in the environment. These three different things here, contamination, proliferation, and survival, are really helpful ways of thinking about how, really, in any circumstance, if someone asked you, okay, how does somebody get sick from foodborne illness? Well, if they got sick, one of these three things, or possibly more than one, occurred. Either something was contaminated, either proliferation occurred, as in food was temperature abused and bacteria in that food were allowed to multiply, or survival. You needed a kill step, you didn't get a kill step. You needed to cook something to a proper temperature, and you didn't. These are the things that are going to be leading to illnesses. Okay, we've gone out on site and we have asked questions and we've interviewed people and we've looked at processes and we have maybe taken samples. We've done all these activities, and if we do that well, we're usually able to find a contributing factor, or that contamination, that proliferation, or that survival that I talked about. That's great. You know how somebody could have become ill. Um, Now, what we need to do is transition from the how and go to the why. And we need to find out the why. The why is critically important because we need to know the root cause, because knowing that root cause is going to help us implement control strategies to stop the outbreak and prevent it from occurring again. It's great if we can identify and say, hey, here's why it happened. But if we can't get that behavior change, if we can't put things in place to actually make a difference, a lasting difference, we're going to continue to have problems. You see these 5 different boxes that I have here. These are the 5 categories that researchers have theorized are responsible. They explain root causes of why outbreaks happen, or the why.
Clay, may I interrupt you just 1 second?
Sure.
That box is showing on everyone's screen and blocking the bottom.
There we go.
Thank you.
Sure thing. Thank you for that. Okay, so clear view of these boxes now. You can see that we have people, equipment, food, processes, and economics. These can all exert either a positive or a negative impact on a food safety system. And when we transition from the how into the why, we're going to be looking at, okay, are each one of these elements, are they contributing in a positive way? Are they contributing in a negative way? And so for people, we need to understand the characteristics and the attitudes of the people that are working in the establishments and whether that is causing problems or not. For processes, we need to identify the characteristics of the processes used to prepare food and food preparation complexity. For economics, this is going to deal with, just like it sounds, the costs, the profit margins, and more broadly, the availability of resources. Once we get into the equipment, the next one, this pertains to the physical layout and the equipment inside the establishment. So you can see in a situation where, let's say that we find out that proliferation ended up being the problem. They're temperature abusing a lot of food items. Well, why did that happen? It could be because they don't have sufficient equipment to maintain all of their cold holding or their hot holding. And then lastly, there could be something about the inherent quality of a food that is prepared in a restaurant. You could have a riskier food item like oysters. You could have qualities of a food product that make it hard to clean or wash, like romaine lettuce. So all of these get into the root causes. All of these elements, people, equipment, food, processes, economics, they can all either impact the system positively or negatively. And we need to find out what is going on here so we can target control measures. Okay, let's look at an example real quick, and this one is a good one. In 2014, state and local staff identified a salmonella outbreak in Minnesota. And the lab and the epi, those parts of the group project, They identified 36 cases of illnesses that were associated with a restaurant, and the implicated outbreak vehicle was the dinner rolls. So you can see that, those nice pictures there. Okay, so we're equipped with all of this information from those epi activities. We have a suspected food item. We're going to go into this place. They went into this place and they looked at the past. So based on all that information, those environmental health staff, they focused their activities. They did interviews with workers. They did a review of food prep activities on site that are specific to these dinner rolls. And when they did those activities, what they found was that the same set of brushes that were used to butter the dinner rolls were also being used for raw chicken. Now, the restaurant reported washing and sanitizing the brushes between uses, which is common to happen. So the main issue here was that the same set of brushes were going to be used for raw and ready to eat foods. And what this does is this sets up potential issues like using contaminated brushes on ready to eat food, or it could even point to warewashing failures. To make matters worse, actually, in this case, the environmental health staff also found that the butter product and the brush were being stored in a proofing oven. And if you know proofing ovens, you know that that's going to be like a perfect temperature for salmonella to survive and proliferate. And so because of this approach, those environmental assessment activities were able to identify contributing factor to this outbreak, which that contributing factor is going to be contamination, or in this case, cross-contamination. So putting this all together, you can kind of see what I've been outlining so far. In summary, they had a foodborne illness outbreak that was related to dinner rolls. They go on site, they do those activities that are included in an environmental assessment, those activities that are different from a routine inspection. And because they did it that way, they were able to identify the contributing factor, cross-contamination, workers using the same brush on raw chicken and bread rolls. And they could also further identify the potential environmental antecedents or root causes. And those could be processes or people failures. Workers were supposed to wash the brushes between uses, but didn't. Maybe because they were busy. Maybe workers felt like they didn't have time to wash that brush. But also we see equipment-related root cause, which is the restaurant just didn't have separate brushes for raw and ready-to-eat food, which if you were in that establishment, that would be something that you definitely want to kind of recommend or encourage or even mandate. Hey, you're going to need to use separate equipment for this. And when you see it like this, it really highlights the importance of doing an environmental assessment, because if they just went in and did a routine inspection just based on what was readily observable at the time, they might not have gone deep into that process of dinner rolls and where other kind of food flows intersect and find that cross-contamination. They probably wouldn't have found that if they were doing a routine inspection. And this is really why we should be doing environmental assessments, because it allows us to do our part of the group assignment or the group project, so to speak, is finding out that how and finding out the why. Okay, that's a lot. There's a lot more information to go into as far as environmental assessments. Because of that, because I kind of compacted all that information in a very short period of time, I'm going to go through, there's a lot of different links and resources that are able to go into much more detail that are quite helpful. And if I remember, I think that there's some QR codes on these as well. Yeah, and so if you're new to this, this is something that you definitely want to check out. The CDC has launched the Environmental Assessment Training Series, or EATS. And EATS is composed of 3 sections. There's a 101, 102, and a 103. And 101 is like basic training on what's needed to conduct these environmental assessments. 102, that incorporates some additional scenarios. And 103 actually focuses on food defense. But these modules are great. If you haven't seen these before, it kind of puts you in a virtual environment, allows you to test out those skills. And each completion of each course usually takes about 8 to 10 hours to complete. So they're in depth. I should also mention before I leave this slide, they are free. They're web-based. You can do them self-paced. You can do them on your own time. They're very good. Something else that's been really nice, we've mentioned root causes or environmental antecedents in this presentation. The CDC has worked with some of the NEARS users to develop resources to help you identify root causes. This is a fantastic document, which is really nice, kind of takes you out of that headspace of just normal inspections and really looking at why did this happen in the first place. So I can't recommend that document enough. And let's see here. NEARS. I've mentioned NEARS a few times. NEARS is the National Environmental Assessment Reporting System. And it is pretty much a surveillance system that's designed to capture components from environmental assessments. And it does systematic data collection of practices in restaurants that have outbreaks. If you're doing an environmental assessment and you're in NEARS, you'd be filling out a NEARS report for each visit. Now, this NEARS report is not an environmental assessment as far as, hey, if I complete the report, I'm all good. It's just a part of this process. It should help you make sure that you have all the needed information to identify the cause of an outbreak. If you're not familiar with NEARS, it is a companion system to NORS, which is the National Outbreak Reporting System. And NORS captures the epi and the lab side. NEARS captures the environmental health component. This reporting system is very successful in what it does. It's generated a lot of really valuable information, and it's been used to identify that employee food safety training and having cleaning policies is actually associated with smaller noro outbreaks, which is great. And additionally, data from NEARS is used to help inform national food safety policy discussions. So it's a very great resource. If you're not participating in NEARS, that's definitely something that you want to think about. The CDC also has some other resources available on their websites there, and you can see those. And then the last one here, just a shout out to Food Safety Centers of Excellence. These Food Safety Centers of Excellence, they have a plethora of materials, such as key areas to investigate based on a pathogen. So if you're dealing with salmonella, here's kind of what you need to look for, or if you're dealing with E. coli or something like that. They have sample forms and a lot more. So there's a wide variety of resources that you have at your disposal. All right, back to you, Nicole.
Great. Thank you so much, Clay. That was a great presentation. For any questions that all of you may have for Clay, please use the Q&A to submit those, and we will address your questions during the Q&A session, okay? Next, you will hear stories from food safety and foodborne illness investigation experts, Sarah Scanlan from the State of Wisconsin Department of Agriculture, Trade, and Consumer Protection, and Danny Ripley from the Tennessee Department of Health. Then we'll jump right into the Q&A session. So please go ahead and submit your questions in the Q&A. Sarah, I will pass it over to you.
Great. Thanks, Nicole. Can everyone hear me all right?
Yep.
Okay, great. I do want to give everyone just a little bit of background as to how our state works. State of Wisconsin is a decentralized state. That means that we do have agent counties that take on our retail program and do inspections for us. That means they're also the lead when it comes to investigations. My role as NEARS coordinator is to be the subject matter expert and assist them in investigations and environmental assessments when needed, especially for a surge capacity if they maybe don't have someone certified or just need some assistance. So I'm going to start by telling you all, I apologize if you've heard this outbreak at Inform this year, but I felt that it was relevant enough to go ahead and just share it again here. So in 2022, we were alerted to a salmonella outbreak that was occurring in one of our counties in the southern area of our state, and all of the individuals that were becoming ill were actually in a very small geographic area, about 2.5 mile radius. So at first we got a couple of cases that came in, about 3 of them in September. They weren't very good food historians, and so again, coming into late September and then October, we had a few more cases, and we were struggling to find the source because of the poor food histories that were coming in. Cases did stop coming in, and so unfortunately, we really weren't able to get a hold on, where things were going, and our investigation kind of stalled until November came, and we were able to identify an additional salmonella case. During that time, shortly a few weeks later, we had another 2 cases, and 2 of those individuals did identify a restaurant that had been on our list, but again, we just hadn't had enough information to really kind of pin things down. So in that situation, we did do an environmental assessment. I should say the local county did. The local county didn't actually have someone that was certified through years, and also hadn't really done a whole lot of environmental assessments before. So as information started to come in, we decided to do some sampling. Specifically at this point, we knew that we were looking at Salmonella infantis. And they were all closely matching within 0 to 4 alleles, with an additional case that was pending. Through our sampling, we were able to identify that the bandsaw, which was sitting rather close to an uncovered, ready-to-eat case, hot case, where things like tamales and other typical Mexican-style dishes were being served for lunch. That bandsaw was, as you may guess it, was cutting raw meat, and ended up being a match to our stool sample cases. We thought at that point, great, we can, make some recommendations, and that is what the local county did. However, after those recommendations were made, we had another case that was reported to us in early January, at which point I decided that maybe they needed a little assistance, and I came out to do another environmental assessment and assist them. We did a full food flow to just kind of see, what they were doing, as well as asking them to completely tear down that bandsaw, show us how they were cleaning it, discuss, when they were cleaning it as well. We did discover that not only did they really not know how to clean it, it wasn't being cleaned as often as it should be. And the hot case was continuing to have some hot holding issues. So that was not only did we have the opportunity for contamination, but proliferation was also occurring. We did make some recommendations to move the bandsaw to a different area of the kitchen where raw food was already being processed, which they did do, and they were placed on a risk control plan where they had to monitor their cleaning frequency for that bandsaw, report it to the local health department, and also monitor their sanitization concentration as well. Things stopped. They were quiet for a while, and we thought that we had figured it out, only to have another case, salmonella case, this time it was Salmonella Munster, pop up in February of 2024. So a little while later, about a year later, from the time that we concluded the first one. I do want to point out that one of the reasons why this is important is because prior to my time in this role, this same establishment had a previous Salmonella outbreak in 2020, and it was, again, a different species. So this is now the 3rd species with this particular retail location that we were looking at. It was automatically flagged by one of our EPIs because they saw Salmonella, they saw this establishment, and they kind of were like, I wonder if something's going on there again. And sent it to one of our epis who called me and was like, hey, I don't know if this is a signal, but maybe we should be proactive and just kind of take a look at it. At that point, we decided we were going to take a look at it and be proactive and do environmental sampling again. And shout out to Danny and his team who were so gracious in helping us determine what we should look at for sampling, match up our sampling protocols, make sure that everything was just as it should be before we went out there. So thank you to that team. They are wonderful if you've never worked with them. So we did go out and perform some sampling, and what we found is basically gross contamination. And what I mean by gross is I don't mean you, that was gross. I mean, we had a large amount of contamination. So we took a total of, I believe, let me just double check my numbers here, make sure I did not get it right. Or I'm sorry, I did not get it wrong. But we took a total of 30 samples. And 21 of them came back positive. And it did match our case patient. It was all over the facility. And based on the environmental assessment that we did, we discovered that what was happening is people weren't washing their hands properly between raw food and ready to eat foods, and basically any food contact surfaces and non-food contact surfaces. So we just had some really, really poor hand washing and cross contamination occurring. It did result in, unfortunately, having the facility closed so they could properly clean and sanitize. They were then able to test on their own, and things came back negative. We didn't have any positive hits. And then we tested again after them to make sure that things were clear, make sure we tested other areas that they didn't test, and we were able to reopen that establishment. I can safely say that we, to this point, have not had any further outbreaks or any further cases. The local health department has worked very closely with them in the last couple of years. They do have higher inspection frequency, as well as a new person in charge that is working closely to help change their food safety there. Laura asked, was the FSC placed on a monitoring plan? I'm not sure if she's maybe asking about a sampling plan, but they do have an open relationship with that same lab. And we did have a possible case a couple of months ago that we were concerned might be linked to them, and did do some sampling, and things came back negative once again. But as everybody knows, just because there's negative samples doesn't mean it doesn't exist. It just means we didn't find anything.
Yeah. Thank you, Sarah. That was an amazing case to share with everyone. Wow. All right, Danny Ripley, we are going to move over to you. Please share your story with us.
All right. Thank you, Nicole. And Sarah, thank you for the kind words. It's always a privilege to help others out. And, anytime anyone on this call has something, a question that Tennessee can help out with, we're not called the volunteer state for nothing. So I'll extend that invitation to everyone. So what I want to talk about is another protracted outbreak that we were involved in that also involves some sampling. This outbreak was a Salmonella I4I outbreak that occurred in West Tennessee through the months of September into November, and maybe a little bit longer, but that was last year. And we learned of this outbreak through our pathogen surveillance. We identified 9 different cases, 5 in Tennessee, 4 outside of Tennessee, that were all they all had clinical isolates that were genetically linked with this Salmonella I4I strain. So looking into going back and doing more interviews with these folks, we learned that there was a common restaurant in West Tennessee that was surfacing, and or exposure to the area by some folks out of state. So we decided to go into the restaurant and do some environmental work. In that environmental work included environmental sampling. And what we did, we took samples in the kitchen using a protocol that we developed. And I should back up just a little bit. With sampling in Tennessee, it's been going on for about 10 years. It's not that old. And we developed protocols throughout the course of 10 years and modified those protocols. And I think with whole genome sequencing, sampling is more valuable today than it's ever been. And it should be part of your toolkit in terms of environmental assessments. Now, you're not going to do sampling in every single environment or every single outbreak, but in certain outbreaks, such as this protracted outbreak, it can be very valuable. So, in doing the sampling was done. Well, let me back up. The onsets of these individuals, these 9 individuals, ranged from September 18th through November the 21st. So we know clearly that there's being multiple exposures over a period of time. And and we weren't in the establishment doing our environmental work until December, late December into January. And we did our environmental sampling in January of this year. And as it turns out, one of those samples, it was a swab that was taken between a grill and a prep area on the grill line, was positive, and it genetically matched our clinical isolates. And really, what that did was just really connect that environment to those clinical isolates and help inform our corrective actions. In this case, the restaurant voluntarily closed and did a thorough cleaning, hired an outside cleaning source to come in and do a thorough cleaning before reopening. Thankfully, we have not had anything resurface at this time in that. And I think the take-home point for this in this particular outbreak is that it's really, as I said, with whole genome sequencing, sampling is a valuable tool, and it's important to have a protocol that you've vetted and that you've trained your staff on. That you have tools that your lab or that are approved by your lab, and your lab's aware of what types of samples that you can provide them and what type of analysis they can provide you, what type of pathogens can they test for. Have all that worked out, have those protocols, those plans worked out well in advance, and then finally train those protocols to your staff, to those key environmental health specialists or folks that might be responsible for doing environmental work during outbreak investigations across your state. We do trainings, and we've trained all of our staff across the state at some point in the last 5 years on both environmental assessments and sampling. And we've got kind of a new training now that really highlights the sampling component and provides a lot more information about environmental sampling. In fact, we just administered that class last week to the folks in Knox County with big success. So, and I also want to point out too, when it comes to environmental sampling, that it's not only effective in kitchen environments, it can work in a lot of different environments where you might be investigating enteric diseases or enteric outbreaks. We have identified and linked the pathogen in norovirus outbreaks associated with splash pads, S-Tech outbreaks associated with petting zoos, and the sale of raw milk or farms that were harvesting raw milk for sale. Salmonella outbreaks in chicken coops, as well as salmonella outbreaks in private terrariums, reptile terrariums. And we use the same techniques, we use the same tools, the same protocols, and it works. And I encourage folks, if you don't have a sampling plan in place, by all means, look into it, because it can be very, very valuable in filling in some of those missing pieces in these outbreak investigations.
That was great, Danny. Thank you so much. All right, we are going to address some of the questions that you all have submitted here. So Sarah and Clay, if you'd like to come on with Danny, all three of you would be great. And I'll just start here at the top. So the audience would like to know, is there a standard form that is used when conducting environmental assessments?
Well, let's not let us all talk at once.
Well, I was going to answer it.
Okay, I'll let you answer that.
No, I'm just kidding.
No, so I would say that we don't necessarily have a standard form that we use. We obviously do use the same NIRS form that Clay mentioned as an additional tool. But to be honest, a lot of times the questions that I'm asking are not only based on the outbreak itself, but also going to be tailored upon what they're telling me as we go along. So I hate to tell you no, but I personally am not using one. if Danny or Clay are using some additional tools that they recommend, that would be great to hear. Obviously, there are some questions that always come up, especially if it's like a norovirus outbreak, but pass it on to them.
In Tennessee, we don't have a standard form that we use. We do collect NEARS data, and the NEARS data does help facilitate our environmental assessment, clearly. But we don't have a standard form that we use. Now, I've seen some forms that have been used in other states. I'll pick on Minnesota. They have some really neat forms for different pathogens that they're aware of. Like, for example, if they think it's if their hypothesis is it's a norovirus outbreak, they have a norovirus form of questions that they want to make sure they ask. And that's a really great idea. I can't tell you how many times I've had to go back out to an establishment because I forgot to ask a question. And that's important that teams rally, the outbreak teams rally before going out and doing environmental work and making sure a lot of those questions are discussed and agreed upon, and you have that list of things to collect. But in Tennessee, unfortunately, we don't have anything. Outbreaks are so dynamic. As Sarah just alluded to, there's so many moving parts, and those hypotheses can be very different with different outbreaks, and we just have to work with the available information that we have. There's fundamental questions that we always want to ask. That would not be a bad idea to have on a checklist, but yeah, we're kind of a blank sheet or open page going into the investigation.
Yeah, and I would just piggyback off of that. I think kind of yes, you have a scaffolding with NEARS as far as observations and manager interviews, and obviously that needs to be done if you're in NEARS. You get a lot of good information from that. I did share, I think the resources on one of those last slides was pathogen specific checklists. Those are really good too. But kind of like if you're studying for a test, and somebody makes a study guide, usually the person that benefits from that is the person that makes the study guide, because they spend the time thinking about it and writing down, well, okay, here are the different things. It's like for your investigators, spending the time before you go out into the field thinking about, what if I run into this? What if I see that? What if they're doing this? What if they're doing that? Spending the time kind of brainstorming, okay, what am I looking for? What could be going on that could have explained these illnesses? That's typically what we would do in addition to that kind of main scaffolding. And you'd be surprised, a lot of questions come up that way, especially looking at menus, things like that.
Got it. Thank you all. Another question here. This one is also from Brittany. I'm from a tribal environmental health department in Wisconsin. Do you know of any resources for food or surface sampling at food establishments?
Well, sorry, go ahead. Nope, go ahead, Clay.
I believe it's the New York Integrated Food Safety Center of Excellence. They have a lot of very good trainings on sampling. And that would be probably one of the first places that I go. They have videos, they have impromptu kind of trainings where it's like, okay, I need to go out and do sampling. Well, you need to watch these videos first before you do that. They have a lot of good resources there.
Sarah, did you want to add to that?
No, I can see that Danny's going to take what I think is what I was going to say. So I'm going to pass it to Danny.
Well, maybe not. I was just going to add that there's a lot of valuable resources in the COE documents out there in those clearinghouses that exist. So you could that would be a wonderful starting point in looking at all the different COEs, Tennessee included, and you might find what you're looking for, good valuable resources there in the way of environmental sampling.
I guess what I would add to that is, Brittany, if you ever have the opportunity to attend some of the Inform conferences or some of the AFTO conferences, they often convince Danny to come out and present on sampling. And he's done a really good job of actually demonstrating some of that. And I want to say that one of the COE's Centers of Excellence will even come out and work with you to do sampling training, but I don't remember which one it is. So I do apologize that I don't remember offhand.
Yeah, there is a sampling course that can be taken through the Association of Food and Drug Officials. And that is available out there. And a lot of the COE states, well, I know Tennessee, we've taught that class to our partners across the Southeast region, as well as folks inside Tennessee. So that is something that you could look into as well as a more formal training. It would require a little bit more effort in pulling people together. It wouldn't be just like a resource that you sit and read, for example, but that is something that does exist.
Great. Question from Jessica. How do you know where to sample inside of an establishment?
So I'll jump in first. It really depends on the pathogen. If we're dealing with certain pathogens that may live in certain areas, or we suspect they come in certain pathways, then those would be our target areas. And if we're looking, for example, if we are thinking we're dealing with a norovirus outbreak and we're trying to find that link between the infected worker that we couldn't interview or test and the environment, we're probably looking at things like touch points primarily, or we're looking at things perhaps in common areas like restrooms or in dining areas. Whereas if we're looking at something like a salmonella pathogen that if we suspect came in on, let's say, some pork product, we would probably look at where that pork product was being processed or handled, and then of course it's always about the details and where in those areas do we sample, how many samples do we have. If we're limited to 15 or 20 samples, we have to be very selective in terms of what we sample. Again, that's going to be something that the team decides well in advance to going out and doing that sampling.
Thank you for that. Let's see. Is there a list of labs that have the ability to do whole genome sequencing that you guys are aware of?
I'm sure it exists. I'm not aware of it, though. Unfortunately, I'm not the person to ask on that one.
Same. Okay.
Yeah, I'm also not aware of it. We always use our state lab. So I guess I couldn't speak to that.
Okay. All right. Another question. Is there a sampling matrix for target locations when dealing with outbreaks like salmonella, such as equipment used in workflow, floor sinks, ice machines?
I guess I'll make an attempt at that question too. Again, the pathogen, we would probably be trying to strategically look at where we think that pathogen may come into the environment and work our way from the most contaminated, the least contaminated to the most contaminated areas. And it's likely going to be in those areas where food contact surfaces exist, or areas where things may drip, split, splash, or spill and collect over a period of time. And not those clean sanitary work surfaces are probably not going to be our best bet. Now, if you've got 100 samples that you can take, then you can really do a nice, robust sampling. But if you've only got 15, you really have to be selective. And again, it's based on the pathogen, based on the available information. Again, if you have a signal on a specific food, you know where that food's being prepared, how it's being handled, then you can start there and then work your way out.
Thank you, Danny. All right, let's see. Do you all know of any environmental assessment resources available for potential waterborne outbreaks? No. Nothing comes to mind.
Specialized specifically to food. So unfortunately, I can't help with that one.
Yeah, okay. And let's see, what types of enforcement actions would you take against facilities, or can you take against facilities where foodborne illness outbreaks occur?
Looks like Clay.
I can just speak for the jurisdiction that I'm in as far as it's always worth looking at the actual, like if you're actually regulatory, what codes you regulate people on. That's going to determine what abilities that you have. And sometimes you might look in your own environmental health code and you might find that if some establishment has been implicated in a foodborne illness outbreak, that gives you some extra tools that you can use. And that's probably the first place that I would look. It's always a case-by-case basis. There's not really any general advice for that.
Yeah, in Wisconsin, oh, sorry, go ahead.
No, go ahead, Sarah.
In Wisconsin, we do have through our food code and 97, we have the ability to put food on hold, dispose of food. We do have the ability to order temporary closure if need be. Some of those things we're only going to do if absolutely necessary. But because we do have those local health jurisdictions that I mentioned earlier, they actually have a broader public health authority that once the public is at risk, they can take more broad public health action. But that's usually through the health department and whether or not they have support from their corp counsel or their legal counsel.
All right. Thank you. So we have about 4 minutes left, and I have a couple announcements to close us out with. So allow me to share my screen once again. All right. Oops, sorry about that. All right. So for NEHA's mission is only possible because of the generosity of people like all of you. When you contribute, you're not just making a donation, you're investing in the future of environmental public health. Your gift helps us, sorry about that. Your gift helps us provide scholarships, support critical research, and expand training opportunities for professionals who protect our communities every day. Together, we can make sure that environmental public health professionals have the resources they need to meet today's challenges, and making a gift will help advance this vital work. So lastly, sorry, we would like to give a huge thank you to our expert guests, Clay Callaway, Sarah Scanlan, and Danny Ripley. Thank you so much for taking the time, sharing your experiences and your knowledge with all of us today. We have one final request of everyone in the audience. And if you wouldn't mind taking just 5 minutes to provide us your feedback on today's seminar by completing our short survey. Your feedback is valued, and we do read it, and it assists us in being better able to meet your needs in our future seminars. In addition, all of you will receive a follow-up email, which will include all the links from today's presentation and resources, including the link to today's recording. Thank you again for being here with us today, and wishing you all a wonderful rest of your day. Goodbye.